The purpose of this research was to examine whether alcohol expectancies and protective behavioral strategies affected the alcohol consumption of college students. Prior research has focused on alcohol expectancies and protective behavioral strategies as separate factors. This study aims to expand the research on alcohol consumption to look at how both alcohol expectancies and protective behavioral strategies influence the drinking behaviors in college students. Alcohol use tends to be common among college students in the United States. According to DeLima, Pearson, and Kelly, approximately 80% of students consume alcohol, and about one-third of those students will engage in binge drinking behavior. Alcohol expectancies are believed to influence a student's decision to consume alcohol. These expectancies can be positive or negative. The positive expectancies, according to Fromme, Strout, and Kaplan, include increases in social status, enhanced social skills, or more friendly, outgoing behaviors, while the negative expectancies include more negative aspects of alcohol consumption, such as feeling sick or dizzy, being clumsy, or increased aggressive behaviors. Madsen, Arnau, and Lambert defined protective behavioral strategies as skills and behaviors which can help reduce the negative and even dangerous aspects of alcohol consumption. Protective behavioral strategies can be split into two categories: serious harm reduction, which includes things like using a designated driver, knowing where a drink has been at all times, and making sure to go home with a friend. The other category is controlled consumption, which includes things like not exceeding a set number of drinks, avoiding drinking games, and alternating alcoholic drinks with non-alcoholic drinks. Alcohol consumption tends to be higher among groups of men than groups of women. According to Crawford and Novak, alcohol tends to be more of a central aspect of social gatherings with men than with women, which can lead to higher levels of peer influence and social acceptance for men. At the beginning of this study, it was expected that participants who hold higher positive expectancies will consume more alcohol than those who hold higher negative expectancies. It was also expected that women will use more protective behavioral strategies than men. Participants were recruited through Maryville SONA systems and social media sites such as Facebook. A total of 73 participants over the age of 18 completed the survey. There were 50 female participants, 19 male participants, and 4 participants who preferred not to report their gender. Those 4 participants were excluded from the data analysis on how gender influences the use of protective behavioral strategies, leaving a total of 69 participants for that analysis. Participants were asked to complete a survey which included questions about the quantity of alcohol he or she consumes on a weekly basis. Answers to the 18-item Protective Behavioral Strategies scale were recorded on a 5-point Likert scale, from 1 being never to 5 being always. Answers to the 38-item Alcohol Expectancies questionnaire were answered on a 4-point Likert scale, from 1 meaning disagree to 4 meaning agree. An independent samples t-test between gender and both categories of protective behavioral strategies revealed no significant differences between any of the variables. It was expected that women would use more protective behavioral strategies than men. However, based on data analysis shown in Table 1, men and women reported almost the exact same average scores for the use of protective behavioral strategies in both categories. A positive correlation was found between the positive alcohol expectancies and the total number of drinks participants consumed per week. This shows that as the number of drinks per week increased, the scores for positive expectancies also tended to increase. There was also a positive correlation found between both the positive and negative alcohol expectancies. Higher positive expectancies correlated with higher negative expectancies. This makes sense because, as the previous correlation revealed, a positive correlation between total consumption and positive expectancies. Those who consume more alcohol are more likely to experience negative consequences of alcohol consumption, such as feeling dizzy or clumsy. However, there was not a significant correlation found between negative expectancies and the total number of drinks consumed. There are some limitations in this study due to a small sample size of 73 total participants, which limits the generalizability of the data. The lack of a significant difference between the use of protective behavioral strategies in men and women could be partially due to the unequal number of female versus male participants in this study. Future research should continue to examine protective behavioral strategies and alcohol expectancies, but should use a larger and more diverse sample size.